at the consult for Badi Shaheen to see how he can fix this, as it is quite grotesque with all this here and drooping, the face all here, and my eyebrows different with the going the other direction. So you can see the mouth.
Hello.
Hi, how are you doing?
Rebecca?
Yes.
Hi, Felicia.
Nice to meet you. All right.
This is Caitlin. She's an intern with me.
Okay, good.
Yeah.
Well, it's
Tell me what's up. What's happening?
Well, I went to Dr. Alessi, and unfortunately, he did not do a good job. It's all askew on one side. He put the eyebrows up, and they one didn't hold. This one just
You mean they
undid.
did the endo brow lift? Is that what
I
it
believe
is?
that's what he did. And
You
then
don't know what they did to you.
No, I don't. Exactly.
Oh.
So he put some scars up here, and this one undid, and then so you can see this whole side is different, and then over here it undid, and so
What's in the back?
he said there was a whole hematoma thing happening here, so he cauterized, and then he tried to fix a revision here, and that is a disaster. So basically it's sort of like a landslide on one side.
Okay.
Yeah.
How old is the work, and what? It would be helpful if I know exactly what they did to you.
Yeah, it was March 23rd
Okay.
of 2020. And
Oh, it's been a while.
yes, and we do have a lawsuit going right now currently. We're in the interrogatory stages. So I want to get basically your opinion of what it would cost to fix it all. So that's sort of why I'm
Okay,
here.
I just need to know more. What was done? An endo brow lift?
He did not state that in the medical records. The medical records are not.
You said you have a lift.
Yes, because
Yeah.
I had the scars up here.
Okay, so that's
when
an
I
endo
woke
brow
up.
lift.
Yes.
And they fixed the forehead for it, right? That was like they did the lifting and they did the fixing.
He pulled, I guess, up here and
yes.
here, but the eyelashes are going this direction on this one, as you can see. This is different than the other one.
Did they talk to you at all about like a little bit of facial asymmetry from the beginning? Or no?
Well, I didn't look like this before.
Sure. No, I'm just saying. Our halves are always different. When I do facial work, I do a lot of facial balancing, facial work.
But I didn't have that problem before. This is what I
Yeah,
looked
yeah.
like before. It was symmetrical before.
I didn't say. I'm talking about the bone and the structure. Yeah.
Yeah. So yeah, I looked normal before,
Yeah.
and I had cheeks.
You look beautiful. I'm just trying to understand what happened.
Yeah, the Kenalog really did a lot of damage. He did 2.5 years of Kenalog injections to the columella to try to take out scarring in the nose.
So you had a rhinoplasty as well?
Years ago, like 20 years ago,
Okay.
and I went back to him because there was a little bit of scarring on the columella. So he said, well, we can take that out with Kenalog.
Okay.
Well, all of a sudden the hematoma happened and the neck all swelled up, and he said, well, I'll do it all here. I'll do the Kenalog in here. And he did other injectables as well. And then I ended up looking
What
ridiculous.
did he do for the face beside the forehead?
He just said he called it an updo, whatever that meant.
Okay.
Yes.
So where were the incisions?
Here and across here.
Okay, so I see an incision for a facelift through the and behind it.
Yes.
Okay. And where were the Kenalog injected, Rebecca?
Here and in the neck.
Did they do surgery on the nose as well, or no?
He just did it.
You had
he
the
did
the surgery before.
Mhm.
Okay.
And then because there was a scarring
Sure,
here,
sure.
he decided to use the
The
injectables. But what it did is it malformed other areas.
Affected other spots.
Yes,
Yeah.
and then all my cheeks caved in because of all the Kenalog. Kenalog apparently
Did you have
atrophies.
It does. Did you have catalog in your cheeks?
He put it here and through here, and then I lost my vision because of it. But now I've done the
Why
vision.
did you have it here? I'm just trying to understand.
There was a bit of a scar through here and here, so he thought that he could use the Kenalog on the scar
treat it.
there, and then a scar
What's the scar
here.
here from?
I guess a dog bite when I was a
I
child.
see. So older stuff.
Yes,
okay.
yeah. So he thought he could remedy that, but what he did is I developed
Had
a
more
cataract
atrophy.
and atrophy, and so I had my eyes, the cataracts
Mhm.
done
Mhm.
of this year, March and April, I believe it was that I did that.
Okay.
And so now I have the vision. It's not perfect, but I have more vision than
Which
I did.
vision did you lose?
I lost the left completely and the right midway when they did the surgery
When they did the surgery
for the cataracts.
For the cataract.
Yes.
Now, what is the vision relation to the plastic surgery?
The Kenalog did it.
Okay, and what's the time frame between the catalog and the cataract surgery?
2.5 years.
From the last injection
Right.
to
He did 2.5 years of injections.
I see. Ongoing.
Ongoing.
I see.
And then
I'm just trying to
on
understand the process.
On the, I guess 2 weeks before I went blind, he did more up in the eye area, and then it completely hazed over. So it was related to the Kenalog.
I see. Inside.
Yeah. So, and then like I said, I had cheeks, but all of the Kenalog took out the
So
cheeks.
it definitely causes, excess use can cause soft tissue atrophy.
Yeah.
Yeah.
And so the nose is still morphing, and some of the scars are like flaking off. So I take it with Q-tips and put like witch hazel or castor oil. That sort of helps slough it off, and then tweezers and take it off.
Sure.
So it doesn't look very good, but I don't want to look like a stroke victim. I'm not that old, I'm in my 50s, but
Sure.
I don't want to look like it looks bad. You know?
What's your? No, obviously, whatever is done, you can only make improvements. You can't really redo or alter whatever was done, but you can just make things look a little better,
Right.
more balanced.
Right.
And in my opinion, at this stage, the less probably would be better, because the more you do, the more potential issues that can happen with all of that stuff that's going on with you. Where do you stand with your vision situation now?
I can see.
Both
Yes.
sides? Are they back to normal? Both sides?
Well, it's not normal,
Almost.
but it's there. They're going to the cells apparently march back over, so it's a little more hazy on this side, but that's apparently normal. A lot of people have that, where the cells march back over the new lens,
Okay.
and then they take a laser and they laser it off.
Okay. You had the cataract in both
Yes.
done? Yeah. Completely. Right.
So I saw Doctor Who
Yeah, I
just
know
a
Dr. Who.
while back, and he said that you would have the tools to bring this up. That you would go in and pull it up.
I do a technique for forehead rejuvenation. It's a little bit newer than this. I've never been a huge fan of the endo brow personally. The reason is because if anything doesn't hold exactly the same, you have a little bit of lopsidedness. And it's not common to happen, but it's not unheard of as well, as you could tell. So I use a technology called Renuvion, which is a helium plasma, and what it does is it creates the rejuvenation of the forehead, or not just the forehead. I use it on the lower face as well. And people that have had facelifts, that they come in and sometimes they need a little bit more oomph with it. People that have never had anything but they're not ready to have the full-on facelift, then I usually offer it to them in combination with fat transfer, which I do a bunch of at the same time. But basically, it depends on the person. I don't really do one thing for everybody. It's just I kind of create the plan that would fit your face. I just kind of custom tailor
I want
it.
this pulled up. I don't want to do what he did before, because he dragged me along for 2.5 years going, oh, the injections will fix it, it'll fix it. It never did, so I really don't want to do a cosmetic treatment.
No, I understand. I'm curious do you have a before and after of your profile before you had the surgery until, obviously now it's easy to take an after picture, but
right.
do you happen to have that? I'm just curious if you can share those with
I can send it back to you later.
Yeah. I'm just curious to see, because when I do this, I put in a lot of planning into it, and I'm usually pretty honest with the patient. I tell them, listen, I don't really think at this point if you do it is going to get you what you want, or it's going to get you close, or I can give them a pretty realistic set of expectations, because I want people to be also comfortable and happy with what they get too, based on what my capabilities are, what the technology can do, and obviously there's an individual factor that plays a role in it, But I'm just curious to see what it is. Now, the joweling, was it much better initially or not really?
Well, it all came undone. It all opened up. And so he had to have me come back to his office later in that evening. And he did the...
That's the hematoma?
Yes.
And after that?
And then it all swelled up because he went in there and cauterized. And so... unfortunately, it left all this sagging down. And you can see that even my mouth is going down this direction. And
a little bit,
there's all
I see all
here.
of that.
So I want that going back up. And because of the Kenalog, it's brought this one down a little bit more too. This was better.
Well, just a little bit more fullness on this side, and it could be just a facial bone thing, but I usually play with the fat to kind of redistribute the facial balance. So if you haven't had surgery and I'm just looking at this, say I want to do this, I would probably put more fat on the right side over the right cheekbone to lift it up to make it more symmetrical. And same thing around the mouth and all this. So it just varies from an individual to another individual, but it certainly will make things a little bit better because it's just more balance, basically. A couple of things I noticed. Number one is I noticed that your tragus is gone. So sometimes when they do facelift, some of them will cut that tragus to allow it an easier closure. I don't know if that's something that was, part of the process.
Exactly, and it doesn't look very good. So.
I'm gonna just put this here.
And if you could bring up that eyebrow and make it symmetrical with the other one, because it's not, and the eye stuff, the lashes, they're going that direction.
I see that, but I don't think that's something I can change the direction of the eyelashes at this stage for you. I don't think I can. Eyebrow, there's a procedure called lateral brow lift, which is an easier and quicker procedure for the patient. That it's an incision into the temple, and that can lift this up in that direction to give it. I think it's lesser.
And at the same time, bring this over, because you see how the lines are now going this way.
You can. I mean, you dissected your face pretty well.
Yes, I want this pulled that direction so that the lines go normal.
You could do the. I don't know if you're gonna get it exactly what you're looking at, but I see what you're talking about. It's not like I don't see it, but this one up a little bit is possible. This one lateral a little bit, except that the scar orientation is gonna need to be behind the temple rather than upward to allow it to go a little bit more in this direction. The issue that I could see is the scar tissue that you have from the prior dissection and the prior trauma to the area will play a role in the overall outcome that we have. Certainly would do. Can this be better I think there's definitely room for improvement. To what extent, I am not really sure. It's just I have to kind of think about it a little bit more. This is just more of initial screening for me.
Do you want to take pictures then?
I will take pictures for sure.
Okay.
We're gonna take some pictures if obviously that's okay with you. And you
Okay.
wanna, this as far as the nose, I don't have an answer for.
Okay.
Unfortunately, there's clearly some soft tissue atrophy, and I to try to go around this is a lot bigger deal, and I don't know if it will get you. I mean, because the cartilage is probably affected with the steroid injection as well, and I'm not really sure. Trying to get cartilage from the ear or getting it from the rib, which I've done all of this and I do this. I don't know if it would be worthwhile surgical wise and cost wise for somebody in your situation. So I would probably stay away from it. If there's an indentation or something, you could just do some medical adjustment to it.
Is there a way to take some of that with a laser? Is there a laser or
Laser
something?
doesn't really, it's not. You get the cannula is shifted a little bit. The bottom part of your septum is shifted a little bit that way. As far as this jowl and the lower face and cheek, there's definitely room for improvement for that. Whether it's done today or in 5 years, there's always a room for improvement with that, because as we age, there'll be a little bit more laxity as well. There's an element, I see a little bit of submandibular gland ptosis, which is common, and that's a lot of people. I don't know the doctor personally, so I can't really speak to what they do and how they assess the patient, but every single patient that I do facial work on, I'll analyze the whole face, and I said, look, this is the picture, this is what's the asymmetry. We all are asymmetrical. I don't care who it is. Everybody, I can find asymmetry in 100 people out of 100 that when I'm looking at their halves. Whether it's breast, whether it's face, whether it's arms, it doesn't matter. There's always asymmetry. First, I would study the asymmetry. I would factor the asymmetry into my surgical plan to see how I can get the asymmetry reduced. I can't eliminate it because I'm not God. There's a different process to that. But I would definitely incorporate that as a part of the process of what I'm planning to do. And I do a lot of facial fat transfer. When I do that, I almost never do the exact amount in the halves. Never. Because it's never. Sometimes I put more on the temple on one side, but then I put more on the cheek on the other side, and put around the mouth a little bit, maybe a little bit more. So it's never exactly the same, but the goal is to become less asymmetric and more youthful, rather than more asymmetric or more accentuated asymmetry, because we didn't plan on highlighting this before. So, and obviously you have the other variables, which is the cortisone with the vision. So there are a lot of other variables that also play the role into the equation. What is your medical factors at this point? Diabetes, hypertension, heart disease, lung disease, kidney disease?
No, none of them.
No. Only reduced vision issues?
Yeah.
Improved with cataract surgery. And the cataract surgery was done approximately,
They did the left one in March,
Okay.
March 8th, and then a month later, they did the right eye in April.
April of this year.
Yes.
Yeah. 2024. Okay, so that's good. And the surgical history, do you have any problem with the anesthesia? Do you have any problem with anything
No,
else after
everything went
surgery?
fine
No.
for that.
So you did the face, forehead, neck lifting.
Mm-hmm.
And did you have your eyelid done at the same time?
He called it an updo. I don't really know
Was there a
exactly.
cut?
No, there was no cuts
There was no
there.
cut. So he
No.
did the forehead basically.
Mm-hmm.
I'm gonna call it an updo.
Yeah.
Was the surgeon a plastic surgeon? Was it a facial plastic? What was the?
Dr. David Alessi.
I know we all hear names, but there's so
Right.
many of us.
Yeah.
I'm just gonna say around this area, or
Yes.
was there any fat transfer done at the same time?
No.
No. Any allergies or background?
No.
Allergies? No. Medication that you take routinely?
Well, I take
Beside
like
that.
the vitamins. I
Yeah,
take
beside that,
berberine.
yeah.
You know, things to try to look younger.
Any prescription medication?
Hydroxyzine,
Okay.
15 milligrams to kind of take away anxiety and sleep at night.
How often do you do it? Every day? Every night?
Every night usually.
UHS,
Yeah.
okay. Smoking?
No.
Did you smoke at all?
No.
Let me have a little. Just want to kind of see the exam. Looking for that specific thing.
You really hate it. It's just this side is bothers me.
Yeah, I think this side is all right. I see just a little bit of jowling. This side is a little bit worse because of what probably most related to complication.
Yes.
And I'm trying to see if you look with your if you look you can look over my arm and you can see this is basically the line. So we're about 2 to 3 millimeters higher on this. Can I have the ruler, please? Yeah, lift. I don't need all of it. Just need, yeah, we're about 3 millimeters.
Oh wow, that's quite a bit, isn't it?
Yeah.
Yeah. It's not attractive. So that's why Dr. Who said that you would undo what he did and then pull them back up the right way. He said that you had the tools for that. So, I asked him to borrow the tools. And he's like, no, he can do it, but I can't.
Yeah.
So.
Well, it probably is partly true because I'm familiar with the endo-brow lift. I'm not a big fan of it.
Yeah, neither am I. As you can see, this is the result.
And
it's
I don't
not
really
great.
know. Sometimes they put an endotime. Do you know if they put an endotime for it? Meaning that they drill a little hole, they put a plate that's absorbable, and then they hike the soft tissue to it. I don't know.
I don't think
know.
so.
Did you feel anything hard at the time?
No.
Okay.
No. I just know that it undid, and there was a lot of blood. Yes.
A lot of blood here or here?
Blood coming down from here. This
I
incision came undone.
Yeah.
Yeah. And a lot of blood. Yeah. I think I was a guinea pig on him trying it out. I don't think he had done it before. But fat again would look good because now I have this kind of like little indented thing.
I think fat is always great for any of us throughout as a maintenance because it continues to make us look more youthful.
Yeah.
It doesn't really give us that whole big surgerized look after it settles down. But obviously for the first couple of months, there'll be some swelling and bruising.
And how long does fat stay?
Your own fat, I expect at least 50% of it to stay.
Forever?
Well, as long as your other fat lives. And this is what's nice about the fat. That's why I like it.
Well, that's a good thing then.
Yeah, it's just...
I don't want to look good for a little bit and then look like frightening again.
Well, one of the other things... you don't look frightening. You're beautiful.
I do. I lost a relationship over this, so I'm looking bad.
You went through all that. I understand. But it's... I had a patient, I did, and she looked great for a while, but then she gained about 20 pounds, literally 20 pounds, and then the face started looking a little bit fatter.
Okay.
Because it's your own fat, and I always tell everybody, it's your own fat. So it will take and then it can gain and lose weight with you. So
Right,
it's-
because the cells expand.
correct,
when you
the
gain.
same. So like I usually take it from the abdomen or the inner thigh, wherever it's available.
Yeah. Yes.
So I usually do that, and then I'll take it, and then you have to wash it, purify it, and redistribute it, and put it back.
Okay.
And I don't really, it just, I would say 40 to 70% on average. Obviously, the revisional and re-traumatized areas, which I do a lot of revisional surgery in my practice. Revisional surgery is a little bit harder, so they take a little bit less, and it takes a little bit longer to do. But the recovery is quicker, believe it or not.
Okay.
Because a lot of the healing factors are in place, and they've been in place for a little while trying to heal.
Okay.
So redoing the side is doable. It's an option beside just the fat. My only concern is not having a tragus properly there, so it'll always be a little bit flatter because of that. I usually like to create that little dip. It's called tragal depression. It's not there for you. It's thicker, so it's
Is there
not
any
there.
way to remedy that a little
There
bit?
is a way to make it better. It won't look as good as doing it first time, but it would look better by having a little bit more definition to
Because
it.
it's not the same on the other side, is it?
It is the same idea, but the other side overall looks a little bit better. Yeah.
Yeah.
So the question is, doing a unilateral facelift or one-sided, an option, is that an option for you? Is that an option for me? Is that a good idea? I have to think about all of these logistics and see how I can, because it's a delicate balance, and I want to make sure whatever I feel comfortable and recommend for you that you like as well, and you feel comfortable with it, and I'm able to deliver it.
And this thing.
This thing will be better because it'll go this, but part of this is what I was just describing as the submandibular gland that is not going to go away, because that's part of our salivary gland. But doing this, you see, as I'm doing this, you can see it. You can see it here. This is your submandibular gland. Now the other part here, this is a part of the muscle that is part of what you had initially, and I don't know if he tightened the muscle or what did he do with the muscle over here. But definitely this is part of that process.
Yes, you see, even that, I'm happier, just having that a bit, and then the eyebrow thing. I really need that to.
I think a revision lateral brow is an option. I would have to dissect the whole brow, at least on the right side, to be able to bring it up, because now it's stuck with the scar tissue. Could you hold on to this? As you can see, it just like I'm trying to pull, but there's I could feel a resistance with the scar tissue. Usually when I do this, the scar is inside the hair.
Okay.
Like this. It's called temple, or just about, and then it covers very well with, especially when you have enough to cover it, and then it'll get you that.
Okay.
Yeah, which I think is sufficient. It's not going to be exact, but it'll be better.
It'll be better.
It'll be
And then if
better.
you pull a little bit at the same time over there,
That I'm not
those
not sold
lines-
on that one.
But then the
that
lines
one-
would go back the other way, because right now the lines are going that way. They're all going there. So if you pull just a little bit more on that direction, it'll kind of be even. Yeah. You see when you did
And
that?
you need to go more lower on this side. This is your issue here. Is a little bit more lateral. This one is both.
And that way
This one is
the
gonna
lines
need
that
to
everybody has will be straight up like normal people. And I just want to look like a normal human being as I age. Looking like it's all falling on one side. I can't do that.
The temporal lift here needs to go a little bit lateral out here to pull this.
Yep, and that would be okay. I could live
I
with
mean,
that.
yeah.
But I can't deal with what it is now. I need this put to a normal face.
How do you feel about your lower eyelid?
Well, right now I'm just looking very old and stressed because of all this, you know. So I would like to look like an attractive human being, you know,
Yeah.
and go
When
back
is
into the
your-
dating pool,
Your
you
whole,
know.
your whole issue, I mean, I don't want to know all the detail, but when is it going to be over? Do you have a...
We're at interrogatories, and then they're going to do the depots, and
Oh,
then
so
hopefully
still in the process.
they
What
wanted
about
to
a
hear
year?
what you had to say. That's why I'm taping it, because I won't remember to relay it all. So
But
hopefully they'll just settle
when
out.
we do this, it's a kind of a different proposition. It's a consult for medical reason. What you're doing is a taping for a legal reason, and that's a whole different.
Well,
set
just so
of-
they know what I want.
No, I understand. But
You know?
that's a different set of introduction because we have a
Yeah.
different set of approach to it.
Right.
Yeah, we have to communicate with your attorney. We have
Yeah.
to get different kind of paperwork signed and all that.
Okay.
It's not.
We can do all that.
Yeah, no, I understand, but that we do beforehand. We don't
Oh.
do it after the fact.
Okay.
Yeah,
All right.
yeah. So I'm all what I'm doing today is I'm giving you a second opinion for a medical displeasure with the outcome of
Yes.
your surgery. That's all
Mhm.
what I'm doing.
Right.
I'm not doing any legal deposition. I'm not doing any legal anything
Mhm.
because sometimes I choose not to do that.
Mm-hmm.
You know, but I'm happy to.
No,
do
the
that.
depots for me, like for
No,
the interrogatories for
understand.
me,
I
and
understand.
depots for me.
I think this part probably
Mhm.
related to various reasons, which I don't know. One of them, as you stated, is the hematoma, which is common after surgery. It's not very common, but it's one of the most common complications that happen that stretch the skin a little bit. I do see a difference in the facial symmetry.
Mhm.
I don't really know exactly the exact detail of the before. Like I said,
Mhm.
that needs to be, you need to go back to the original record and see what they documented and
Mhm.
what they do. But as far as my opinion, I think the forehead can be improved.
Mhm.
The lateral cheek, on both sides, there's a little bit of jowling, which is not uncommon 2-3 years after the procedure. Even like a year out, the people will still have a little bit more jowling. I personally tell people that you could potentially, I'd rather you not looking too overdone than overdone, but that's just the style of a surgeon. Some people like to look like a drum, and some people don't. And sometimes you can't accomplish that in one surgery, even if you want to, quite frankly. But those are the items that I'm seeing. As far as the injection with Kenalog, it can cause soft tissue atrophy. Of course, we all know that. So we have to do it judiciously, and I'm sure you've been through different specialists for different reasons. I'm sure they can express their opinion about that as well.
And there's nothing you would do to treat the columella?
I personally don't have anything to offer you. I could see your concern, but shy of like maybe cartilage grafting, which is with something that's been injected that often the tissue are very thin. I don't think I can, with a clear conscience, tell you that I'm going to be able to make it better.
Mm.
But could it be maybe somebody else with more skills can do that? I don't know. I don't really want to close the door completely for you. I'm just telling you. I mean, this is my 21-year experience in the industry. So I that's pretty much what it is. So I'm gonna have them take some pictures for you,
Okay.
and I'm going to kind of look at that medically to see if there's something I can offer, and if that's something that would be satisfactory to you, and all of the other things. But my recommendation for you is to finish up all of the things that are anchoring your personal life down. And I'm not a psychologist, but I personally find that people, once they get a closure on a chapter, they just feel better and they do better with whatever revision they want to do. But that's for you to decide. That's not for me. I'm just giving you an advice.
Okay.
Yeah.
Okay.
I hope this was helpful.
Yes, I think it
All right.
was. Thank
Nice
you very
to meet
much.
you, of course. Take care.
Thank you.